Hi everyone. Today we congratulate Dr. Ornello, all the way from Italy, who published Editor's Choice article about guidelines on pharmacological treatment of migraine in the Journal of Cephalalgia. We're very grateful to Dr. Ornello to being today with us and spreading this wonderful information to our listeners and viewers. Welcome, Dr. Ornello. Could you please tell us a little bit about you?
Yes, thank you for this invitation. Thank you very much. I am Raffaele Ornello from the University of L'Aquila, Italy. I am a freshly nominated Associate Professor of Neurology at that university, and I work in Simona Sacco's group.
That's excellent. Thank you very much. I did appreciate that you led this work as first author. So that's like huge amount of things to do. And in your department, which includes biotechnology, um, also collaboration comes to mind immediately. People from multiple countries with leadership of actually our excellent editor of Cephalalgia, Dr. Simon Sacco, worked on this great guidelines. Could you please tell us a little bit about methods?
Yes, thank you for this question. I think that the methods are the most important part of this guideline because they are the most innovative part of the guidelines compared with what we had to this date. The most important part of the methods is that they followed the GRADE methodology. It is a very important methodology and a very rigorous methodology in which you have to document any step of the evaluation of literature. It is a little bit difficult to enter into this kind of method, but it allows you to be entirely transparent, entirely clear in what you do, so it is reproducible and everyone understands what you did. And it's very important, especially for the evaluation of quality of studies, because we can be subjective. We can judge personally what is the quality of a study, while the grade methodology allows you to be objective in the evaluation of quality of studies. There can be some subjective part, but the most important part is that even subjective impressions and judgments are all documented. And it's very important to ensure that you communicate your results and you have the best quality of evidence.
Absolutely. I did see in the article wonderfully describe evidence-based hard data incorporated, but also expert opinion. Both are extremely important.
Yes, not everyone can be evidence-based. So we also had to be practical. There are some drugs that are excluded from evidence-based medicine because they were tested decades ago. We had to explain a little bit about their use in practice, and besides, we had to give some explanations about drug titration, drug combination, and their dosages, their best practices to use them. So those topics cannot be addressed through a hard evidence-based assessment. So we decided to add expert opinions uh, that can guide clinicians in their practical everyday life.
Yes, it has acute treatments and things included which we can use in our day-to-day clinics. Including example would be ibuprofen doses or comparison head-to-head of different medication for acute migraine attack treatment, which is nicely summarized in the table. So we are very, very grateful for that. I hope all our readers will go and look at preventive and acute pharmacological treatment guidelines in this article. And I know in the beginning of our video program, you mentioned few people whom you wanted to give a shout out, including nurse. Could you please do it?
Yes, it of course was an extensive work from that was led by an extensive group of people. First, the chairs for the Italian Headache Society, the chair was Professor Simona Sacco, while for the international part, the chair was Professor Mesouda Shina, and they got an invaluable equipe of people working at it. Then to get together with myself, we have to mention Valeria Caponnetto, a research nurse from the University of L'Aquila that coordinated the efforts for literature search. It was very she was very important in setting up literature search and the overall methods of the guideline. So we made the groups work together to this kind of guidelines. Together with that, we also have to thank all the members of the module working groups and the external reviewers that made a double check on everything. So it was a collaborative effort.
That's amazing information. I am very curious for people who aspired and inspired as I am to create guidelines and consensus in all these different areas of headache medicine, which we need and for the future. What was the year when you started working on guidelines?
Well, it was 2022. It was a
That's
2 year.
amazing. Yes. That's amazing amount of work. We very grateful for that, and we are so happy it's published in the Journal of Cephalalgia. We hope to see you with us again very soon with your future work, and really appreciate your time taken from busy schedule to do this video program with us. Thank you so much, Dr. Arnella.
Thank to you.